Hi, my name is Shane O'Connor. I'm a certified physical and health educator, as well as a medical exercise specialist. And today I'm here to talk about the shoulder and some of the issues and conditions that are common with it and how to best deal with those conditions through exercise. So a few things that you have to know about the shoulder is first that it has three degrees of mobility. Right? Mobility is important. However, you cannot have freedom of mobility without first providing stability. And stability is provided through the joints that are involved in the shoulder. There are 4 joints that I'm going to talk about. First, the glenoid-humeral joint, which is where the ball and socket goes. The sternoclavicular joint, which is where your sternum and your clavicle meet. You have the acromioclavicular joint, which is where your acromion process and your clavicle meet on the distal side. And then you're going to have the scapular-thoracic joint, which is where your scapula reaches your thoracic spine. And all these are very important to understand in order to best create mobility, all right, through stability for the shoulder. All right? So the things that we're going to review when I actually go through the exercises, I'm going to review how to give that scapulo-thoracic joint and your scapula area, all right, the best type of stability. Right? Without stability, as I said before, you cannot have good mobility. Many of you know that when you have a rotator cuff issue or a shoulder issue, it makes it very difficult to lift your arm overhead, brush your hair if you're an athlete, throw a baseball, whatever it may be. These exercises will, without a doubt, help you deal with this. Now, let me say first, you should always contact your medical provider. Make sure that they give you clearance for exercise. And not only that, but we will work with your medical provider to best show you and your medical provider how to manage your condition of your shoulder the best way possible through exercises. With the clients that I've had, these work and they become very beneficial for them, and there's no reason that you can't come back to 100%. So the next part I'm going to take you through is I'm going to take you through some exercises to provide stability for that scapulothoracic area, all right, and mobility, right, which will lead to mobility, and also how to strengthen the rotator cuff muscles. All right, the first exercises we're going to look at are exercises to strengthen the rotator cuff muscles. The rotator cuff muscles, there's 4 important muscles to understand. It's the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. And these are both external and internal rotators. And the only way that you're going to fire them up and recruit more muscle is by actually working them and actually internally and externally rotating. This is a very underutilized exercise, and most people don't do this. They look at the shoulder as one exercise, which is an overhead lift, or for example, shoulder abduction, which is great because it works the delts and it works some of the musculature that provides mobility to the shoulder. But again, you have to have stability before you provide mobility. Okay? And in order to bring the glenoid fossa, all right, which is the socket part of the ball and socket joint, and then the humeral head, which is the ball, down and in to the shoulder, which is extremely important for stability, you have to work on these exercises. And so the exercises I'm going to show you are both internal and external rotation. So I have over here a cable machine, and I have a handle here. And what I'm going to do is I'm going to bring my body out, and I'm going to slightly abduct, meaning take away from my body with my elbow. I'm going to provide about 10 degrees of separation. Now, it's very, very important that you actually provide this 10 degrees of separation, because with this 10 degrees, there's a vein that provides blood flow to your rotator cuff. Blood flow is extremely important in the healing process. It brings oxygen and nutrients needed in order to heal any type of injury that you have in the shoulder, and to also strengthen the muscles involved in it. Now, with the rotator cuff tendon, like I said, it's extremely important that you get this blood flow there. So what I was saying is that 10 degrees of separation, when you close off that 10 degrees, it shuts off the blood flow from that vein, and you no longer get an efficient exercise. So with a lot of my clients, what I do is take something like a water bottle until they learn to do it on their own. I'll stick it right in between like this, and then I'll have them start externally rotating. Okay? For my sake, I don't really need it. I'm going to keep it abducted. So what I'm going to do is I'm just going to, right, nice and slow and easy. All right? Now, a lot of you might not have the type of mobility and range of motion that I currently have now. However, it will get better in the future. So make sure that shoulder is down and in, and you're slowly externally rotating, keeping that 10 degrees of abduction. And that's my external rotators. And I'm going to do about a set of 15 repetitions. All right, I'm about 15 and about 3 more. 3, good, 2, 1. All right, and I really feel those shoulder muscles working and really firing up on the inside. The next one I'm going to take you through is internal rotation. Internal rotation is just as important as external rotation, and you can't do one without the other. All right, so again, I'm going to have, let me actually show you from this side. Okay, so then what I'm going to do is my arm, most of you can't see, but it's also slightly abducted, 10 degrees of separation for the same reason I talked about before. And I'm going to follow the same motion, except the resistance is going to be coming from the inside. Right, so I'm going to slightly internally rotate my shoulder, right, towards my body. Notice when I'm doing this that my elbow is not doing anything but rotating in and out. A lot of common mistake I notice, especially with new clients, is I see them doing something like this because that's the motion you're used to. No, that doesn't. You have to concentrate on those internal rotators and external rotators. Do it nice and slow and easy. Make sure that any type of movement is coming from the rotator cuff. So I'm going to say I did about 15 now. Okay? Now, I did that on 2 different arms. What you would do is you'd make sure you do external rotation, internal rotation, set of 15, external rotation, internal rotation, set of 15, and then repeat that 3 times on each arm. If you continue to do that every day, every other day, you'll notice you'll gain a lot more strength, right? And you'll begin the healing process inside of whatever condition that you have going on. Again, check with your medical provider before you go ahead and start that exercise program, but it pretty much works for every single shoulder injury. As I said before, it's very important to provide stability to the shoulder in order to further increase mobility. Now, one of the main joints involved with stability, as I stated earlier, is the scapulothoracic joint. And in order to stabilize this joint and stabilize the shoulder, you have to work the muscles that surround it. Those muscles include the serratus anterior, the levator scapula, the trapezius, and the rhomboids. And I'm going to show you a great exercise that's simple, easy. You don't need any equipment. You could do this in your office. You could do it at home. You could do it in the gym. You can do it no matter where you are. All you need is as much space as I'm providing right now. All right, and this is what I like to call a row and a tuck. And I'm going to show you how this works. Now, this is going to work on really firing up and recruiting a lot of muscle fiber in the areas that I talked about. And this is a beginner exercise to deal with, to help increase stability. All right, so the first thing you're going to do is you're going to have your arms right in front of you. You have them slightly raised. And what you're going to do is you're going to pull them straight in, squeezing your shoulder blades together, and then you're going to come down and tuck as if you had pockets in the side, right, and tuck those elbows in the pocket. And you really have to emphasize the pull and squeeze. Pull and squeeze. I'm going to show you from a side angle. I'm going to pull and tuck and squeeze, pull and tuck and squeeze. And as I'm doing this, I really feel all those muscles in that scapular area firing up. And let me just show you from one more view. Now you're going to pull, and notice how I'm squeezing together and I'm really tucking. Okay, pull and squeeze. Pull and squeeze. And just as I did with the rotator cuff muscles, I'm going to do 3 sets of 15 reps. And as I said, you could do this anywhere at any time, and you should do this about 3 times a day. That will really begin helping you with stability of the scapulothoracic joint, which again will increase later on mobility. The next exercise I'm going to do is a seated push-up. A seated push-up is important for a few different reasons. First of all, it strengthens the shoulder girdle, right? It enforces good posture. And one of the most important parts is it brings the serratus anterior, one of the most under-recruited muscles in the body, which is extremely important for stability, down and into the rib cage. So I'm going to go ahead and I'm going to demonstrate this with, first, like I said, I'm going to get correct posture. And with correct posture, you want to make sure you bring your shoulders down and in. And then the next thing I'm going to do is I'm going to put my palms gently against the seat. And all I'm going to do is I'm going to lift my body as much as I can without bending my elbows, without using my feet, just simply by using my shoulders. Okay? And it's probably hard for you to see it, but I can feel it, that those muscles that I just spoke about are really firing up, and I'm able to recruit a lot of muscle in those areas, which is extremely important, as I said, for stability. So what I'm going to do is, for the sake of demonstration, I'm going to do about 3 more. So 1, 2, and 3. What I would suggest is that you're doing about 3 sets of 15 repetitions, as I did for the other exercises, in order to best recruit the muscle and best serve for your exercise program. All right, well, if you haven't got the message by now, stability is extremely important in the shoulder to not only correct some of the conditions, but even if you don't have any medical conditions in the shoulder, you're going to want to try to find ways to fire up these different muscles I talked about, especially since some of them are one of the most under-recruited muscles in the body. This will also include injury prevention so that you don't cause further damage or any damage to your shoulder. Now, if you do have a condition, again, you should probably contact your medical provider. Not probably, you should contact your medical provider, and we will work with your medical provider to best manage your condition. What I showed you today was a very beginning stage of an exercise program. An exercise program is always individualized, and we give them to specific people based on their specific needs. If you want more information, you can give us a call, and you could find all of our information on www.integratedmedicalfitness.com. Again, www.integratedmedicalfitness.com for all your fitness needs, for all your medical exercise needs. We're here to help you.